In this episode of the Health Momentum podcast, let me start with a question that might make some physicians pause for a moment. Your reports show a 97 or 98% clean claim rate. On paper, that sounds excellent. Yet at the end of the month, cash flow still feels tight. Staff salaries, rent, technology subscriptions, and insurance premiums keep rising. The numbers say the system is working, but your bank account tells a different story. So what is actually happening behind the scenes? I hear this concern often when speaking with physicians and clinic owners. Many practices believe that a strong clean claim rate means their revenue cycle is healthy. It feels logical. If claims are submitted correctly, the payment should follow. But in reality, the journey from claim submission to money in the account is far more complicated than most of us were taught in medical training. A clean claim simply means the insurer accepted the submission initially. It does not guarantee when the payment will arrive, whether the amount will match the contracted rate, or whether the claim will quietly stall somewhere in the process. Consider what happens after the claim leaves your system. It enters layers of payer review, automated edits, documentation checks, and administrative workflows that most physicians never see. Even perfectly submitted claims can sit in review queues for weeks. Some require additional documentation. Others trigger automated edits that slow processing without ever appearing as formal denials. The claim looks clean in your report, but the revenue is still moving through a long and often unpredictable pipeline. Another issue that rarely receives enough attention is underpayment. A claim may eventually be paid, which creates the impression that everything worked correctly. Yet the amount received may not match the contracted reimbursement rate. Small discrepancies can occur due to outdated fee schedules, coding interpretations, or payer adjustments. Individually, these differences may seem minor, but across hundreds or thousands of encounters, they can quietly reduce a practice's revenue in significant ways. Then there are the losses that occur without anyone noticing. Denials that are never appealed. Claims that expire because of filing deadlines. Documentation requests that arrive while staff members are already overwhelmed with daily responsibilities. These events rarely appear on high-level reports. Instead, they show up as silent write-offs that gradually erode financial performance. This is why many physicians experience a disconnect between operational metrics and real financial health. Clean claim rates may look excellent, yet accounts receivable continue to grow. Payments arrive slower than expected. Administrative teams work harder every month just to maintain the same level of revenue. The system becomes reactive rather than strategic. So what should physicians and clinic leaders watch more closely? Beyond clean claim rates, it is important to understand the full picture of the revenue cycle. Metrics such as net collection rate, days in accounts receivable, and payer reimbursement accuracy provide a more realistic view of financial performance. When those indicators start drifting, they often reveal issues long before a major cash flow problem appears. What I find encouraging is that awareness is growing across the medical community. Physicians are beginning to recognize that operational intelligence is just as important as clinical excellence when it comes to sustaining independent practices. Understanding how revenue flows through the system allows physicians to ask better questions, design better processes, and ultimately regain control over the financial side of medicine. This conversation is not about turning physicians into accountants. It is about protecting the sustainability of practices so that clinicians can continue focusing on what truly matters: patient care. When administrative systems work properly, physicians spend less time worrying about reimbursement and more time doing the work they trained their entire lives to do. As healthcare continues to evolve, the practices that thrive will be those that combine strong clinical leadership with clear operational awareness. The goal is not simply to submit claims correctly. The goal is to ensure that every encounter is translated into the appropriate and timely reimbursement that supports the practice and the patients it serves. Before we wrap up, let me ask you a question. If your clean claim rate looks strong but your revenue still feels unpredictable, what might be happening inside your billing process that you cannot see yet? That is a conversation worth having. If this topic resonates with you, I would love to hear your perspective. What revenue cycle challenges have you encountered in your own practice? Leave a comment and share your experience with the community. Your insight might help another physician recognize a problem they have not yet identified. And if you believe this conversation could benefit a colleague or another clinic owner, please share this episode with them. The more openly we discuss these operational challenges, the stronger and more sustainable our practices can become. Thank you for listening, and as always, keep building momentum in healthcare.